Hello, Wayne County Community College students. I'm Dr. Morrison. We're here to learn a little bit about anatomy and physiology of the digestive system. Our first lecture will be about the anatomy of the digestive system. And we will be using our text from Patton, Dr. Patton, Elsevier publisher, chapters 8, 38, 39, and 40. Chapters 38, 39, and 40. All right, let's get into it, learn a little bit about the digestive system today. So, the organization of the digestive system is that it forms one long tube from the mouth to the anus, and it's open at both ends. So it's one long tube from the mouth to the anus, and it's open at both ends. This straight and occasionally winding tube is referred to as the alimentary tract or the alimentary canal, also known as the gastrointestinal tract, and for our purposes we'll call it the GI tract for short. The GI tract is a tube that's made up of 4 layers of tissue. These 4 layers of tissue, you will be responsible for knowing what they are and where they're located, and know the certain order so that you can figure out where things are in which category, in which tissue. So the mucus lining is usually a mucus lining. We have a mucus lining usually for some type of lubrication. In this case, we have it so that the foodstuffs or the chyme that we'll learn about later, or the stool that's going to eventually form stool, can move through the digestive system with ease. So the mucus lining is the innermost layer. The innermost layer. Not so sure you can see that, so I'll change to a different color. It's the submucosal coat of connective tissue. Submucosal meaning below the mucus layer. Sub means below. This is a coat of connective tissue that is embedded with blood vessels, glands, and the parasympathetic nerve plexus. Remember, a parasympathetic system slows things down, and that is the way you have to basically feel that way in order to get a bowel movement. You can't be all excited and trying to get something done, and the doorbell's ringing, the phone is ringing, you're trying to, no, you have to be calm in order to defecate. So you have to be in a relaxed mood. The parasympathetic nervous system gets you there. So this is the submucosal coat of connective tissue, and within this layer, we have blood vessels, glands, and the parasympathetic nerve plexus, and the specific name for that is Meissner. This is a Meissner plexus. Okay. The next layer is a muscular layer, and this layer is made up of circular muscle, and longitudinal muscle. The interesting thing about this muscle layer with the circular muscle, longitudinal muscle, those things help keep things moving within the digestive tract. They help with the, along with the oblique muscle layer, but that's not included in here, but we'll get to it when we get to the stomach. But as the food moves, it churns and mixes up all the foodstuffs along with the enzymes and acids and bile and alkaline material. It is moving through the system. These muscles help keep the food moving through the system until it forms a proper stool to be pooped out or have defecation. The other thing along with this muscle layer, which is important for you to know, is that there's another nerve plexus in it, and it's called Auerbach plexus. So that would be here. Auerbach plexus is in the muscular layer. The nerve plexus that's in the submucosal layer is Meissner's plexus. The nerve plexus that's in the muscular layer is Auerbach plexus. And a plexus is like a little web or communication of fibers, in this case nerve fibers, and it looks like a web of sorts, like a spider's web, but it's really very well organized as well. Serosal layer is the outermost layer. These layers, I need you to remember them and know where they're located. So you remember the muscular layer, you'll remember that's the innermost layer. Then I want you to remember the serosa is the outermost layer. Think of that as a sandwich that is squishing together the submucosal layer and the muscular layer where the plexuses are, or plexi, I'm not sure. Meissner's plexus is in the submucosal layer, Auerbach plexus is in the muscular layer. So you get that down in your brain, you'll be straight. The intramural plexus, in between the mural, this wall, is the Meissner's plexus and the Auerbach plexus. Remember, the Meissner's plexus are the submucosal nerves, and the Auerbach plexus is the muscularis nerves. So that'll be great for you to get a start on the digestive system. These nerves here, these tissues, layers of tissue, regulates the digestive tract movements and its secretions. These 4 layers form various organs of the GI tract and variations in the epithelial layer of the mucosa. They're going to range from stratified squamous, and then you remember that from when we had 240, the previous class before this one. You'll remember all of your epithelium, the stratified squamous, and of course you remember that provides protection from abrasion. In this case, it's going to be like from the upper esophagus. The stratified squamous epithelium will provide protection from abrasion in the upper esophagus to simple columnar. And you'll remember simple columnar is mainly for absorption. And in this case, simple columnar epithelium in the GI tract is for absorption and secretion. And that will be for most of the GI tract. But it's going to be these 4 layers of tissue that are going to make up the GI tract, and it's going to go from a stratified squamous to a simple columnar with just using these 4 types of tissue here. Let's go on and talk about the mouth. We'll get started with that. So we could get from that first opening, since we said it goes an opening from the mouth to the anus. Let's just see how that goes. Okay, so the mouth, also known as the oral cavity or the buccal cavity. The mouth is formed by lips, cheeks, tongue, and the palates. Okay? This is what makes up the mouth. The lips, the cheeks, the tongue, and the palates. So the lips are, we just have some non This is just some lips, all right? I'll just throw a little philtrum in there so you can know that this little part is called the philtrum, just so that you will know that. Right here are the lips. The thing I want you to know about the lips is that it has this line here, this little tear, and that's called the oral fissure. Oral fissure. If you recall, a fissure is a tear. And I think you learned that before. We mentioned this in respiratory when we looked at the horizontal and oblique fissures in the lungs. Those little lines, those tears. So here's one here separating the lips, right? You have an upper lip and a lower lip, and the oral fissure divides those two. Okay? Then we have cheeks. Cheeks are formed by the buccinator muscle, you know? And they're sandwiched between adipose or fat tissue. And then there's numerous mucus secreting glands in the cheeks. So the cheeks are formed by buccinator muscle. Formed by I don't know if you guys are familiar with Dizzy Gillespie or Louis Armstrong. They played instruments in their buccinator muscles. Their cheeks were always kind of blown out like that, so you'll remember that. The tongue is really skeletal muscle, covered by a mucous membrane. And the tongue is important in that it assists in the placement of food between the teeth during mastication. Mastication means chewing, and it helps with deglutition, and deglutition means swallowing, and the tongue, of course, helps with speech. So I know I just introduced two more words to you, so let's write them down, and because you're going to hear them again, and I will go into more detail about these words. The first one I used was mastication. And we said mastication means chewing. All right, it's a fancy word for chewing. The other word I mentioned was deglutition. And this means swallowing. So these two words we're going to refer to again, but at least they're introduced now, and you'll know that the tongue is the skeletal muscle that helps with chewing and swallowing. Placing the food or substance within range of the teeth, and that helps with the chewing, and then of course the tongue does help with the swallowing, okay? And speech, of course. The palates here, you have a hard palate, and you have a soft palate. You can feel your palates if you put your tongue in the upper and the roof of your mouth. The hard palate is actually made up of 4 bones. So you have 2 maxillae bones plus 2 palatine bones. So the hard palate is made up of 4 bones, 2 maxillae and 2 palatine. The soft palate, it forms a partition It just forms like a partition between the mouth and the nasal pharynx. And I know you know where the nasal pharynx is because you learned that in when we did the respiratory section. So the palates, you have a hard palate and a soft palate. You can feel your palates with your tongue. So up towards your teeth in the front, put your tongue up there, you'll feel these little ridges. That's the hard palate. The hard palate is made up of 4 bones, 2 maxillae and 2 palatine bones. Now put your tongue way in the back of your throat. and you'll feel a little bumpy, soft area there. That's your soft palate. And it's there to help be a partition or a division between the nasal pharynx and the mouth. So it forms a partition between the mouth and the nasal pharynx. That's what the soft palate does. So these are the things that make up the mouth. You have the lips, the cheeks, the tongue, and the palates are what form the mouth. Let's go on and learn about salivary glands. I'm going to ask you about salivary glands, so let's find out about them. Okay, salivary glands. It's going to be 3 of them, and they are just 3 pairs of salivary glands. They secrete approximately, that's a little line for approximately or about 1 liter of saliva per day. So salivary glands secrete about 1 liter of saliva per day. It's a lot of spit, right? And they're paired. So you have a parotid. The parotids, these are the largest. Largest salivary glands. The parotids are the largest of the paired salivary glands. So you have 2 of them. I said these are paired. Let me make sure you know that these, you have 3 pairs. So you'll know that it's 2 parotids, and it's going to be 2 submandibular and 2 sublinguals. But let's talk about the parotids. These are the largest of the paired salivary glands, and they produce a watery, kind of serous, they produce a watery, and I'll say serous saliva. So that's a watery saliva. The parotids are the largest, and they are right here in the cheeks. They produce a watery, serous saliva that contains enzymes. And I'll say containing enzymes. No mucus here. No mucus in the parotids, producing the parotids, okay? Let's go with the second of the paired salivary glands. We have submandibular. Now, where's your mandible? Where's your mandible? Correct, it's in your jaw, right? So these are submandibular, meaning below the jawline, right? Okay. So these are mixed or compound glands, right? And they contain both serous, so they have a watery mix, and some mucus producing elements. So they're mixed. They contain both serous, and we know that that's watery, but also with some enzymes, and mucus producing. Elements. So submandibular is mixed. It's got a little bit of serous and water producing with enzymes and a little bit of mucus too. Here's the third type. These are sublinguals. Linguals means tongue. Sub means below. So these glands, they're paired. So it's two of them. They're paired. They're below the tongue, right? All right. These are the smallest of the paired glands. These are the smallest. And they produce a mucus type of saliva. All right? So I need you to make sure that you know which gland is producing what type of saliva, but I also need you to know the location. Anatomy is more about not just knowing the function of the organ, but you need to know the location as well, right? So the words tell you, well, parotid, well, that's right here in the cheeks. This is the largest of the salivary glands that produces a watery or serous saliva containing enzymes. So when you see serous for the saliva, just think of enzymes. No mucus production in the parotids. The submandibular glands, salivary glands, two of those as well. They're all paired, so remember it's two of each. The submandibular, just below the jawline, is a mixed or compound glands. They contain both serous types of saliva that has the enzymes in it, and they produce mucus too, so it's a little thicker. The sublinguals, just below the tongue, these are the smallest of the salivary glands, and they produce just the mucus. So you got the watery ones in the parotids, the mucus ones in the sublinguals, and then the mixture of mucus and serous or watery ones with enzymes in the submandibular. I need you to remember those so that you will know what's going on in the mouth. And that's what actually keeps the mouth moist. You have buccal glands. These are small glands within the mucosal lining of the cheeks and mouth. And the buccal glands, we'll just say they're accessories. These buccal glands, they're going to really secrete about less than 5% secretion, but they are there to keep the mouth's hygiene and the mouth tissue in order. You know, just to keep the mouth moist enough and to keep the hygiene, keep the bacteria at bay. So this is a little less than 5% of the secretion, but the buccal glands are there to help maintain mouth hygiene. We'll say it like that. Now, even though I have information about the teeth, I don't really go into teaching a lot about the teeth. I will leave most of that for your own edification, your own learning, but make sure you read it. I'll go over a little bit of it. The things that I think are important for us, but you can actually always feel free to, you know, fortify your notes and just use mine as a base, like something that is just a good base for you. But you can always go through the text and add more to your notes from the YouTube videos. And that will help fortify your notes and make them more and better for you, okay? That's one thing I'm counting on you to do, excuse me. Salivary glands needed some help. All right, so teeth, let's do this. Teeth, this is an organ of one of the words that we learned before. This is the organ of mastication, or chewing, right? Organ of mastication. And I'll say, or chewing. The teeth are designed to cut, tear, and grind ingested food. And this is going to increase the surface area and makes it easier for the digestive enzymes to come in, right? So teeth are designed to cut, tear, and grind. And I'm talking about this in humans. Humans have teeth that are designed to really eat all types of foods. And I think that's called being an omnivore. So we're able to, use our canines that are those sharper teeth looking. You can tear with those. You can use the front central incisors to cut, and then you use your molars to grind. So really our teeth are designed to eat all types of foods. So the tooth is kind of made up with a crown. The tooth is divided into 3 parts, And this is where I want you to go to your text to make sure you look at this. The crown, the neck, and the root. So the teeth are divided into 3 parts. You have the crown, the neck, and the root. And I will leave it to you to look at the pictures in your text to find out where those are. But the crown really is the exposed portion of the tooth. That's the part that's covered with enamel, right? Enamel is the hardest and most chemically stable tissue in our body. That's an interesting thing because it's so hard and so stable, chemically stable, but one little thing can mess up enamel. One little thing that really a lot of people all over the world like in different ways, but for us, and we consume so much of it, is sugar. Sugar can tear down some enamel. Of course, you get something called caries or cavities, right? The neck is the narrow portion of the tooth and is surrounded by gingiva. Those are the gums. And it joins to the crown and the root of the tooth. And the root, of course, is the thing part of the tooth that fits in the socket in the upper and lower jaw. It may be a single peg-like structure, or it can have 2 to 3 like conal-like projections. So the root I'll just draw a crown, then I'll draw a neck here, and it could be a double root. You can have it kind of peg-like with one, and then these big old molars like this. You can have 3. So these are the ways the teeth, can look. So when I was a kid, I drank a lot of milk, and my baby teeth or deciduous teeth were not falling out like they should. So as a child, I had to go and get them pulled out from a dentist. That was my first introduction to a dentist, and he happened to be a family friend. And the roots were so long, the dentist said I would have had trouble with the other adult teeth that were trying to push up. They wouldn't have come up properly. They would have gone all these different directions. So they pulled them, and he told my mother to take me off of milk. So I think I ended up going on to some other kind of milk because I really enjoyed milk at that time. But I don't drink cow's milk now. And I would suggest you don't either. You have many alternatives: almond milk, soy, rice milk, oat milk even. Some people have told me about hemp. I haven't tried hemp milk yet. But try to get off of cow's milk, and don't put your children on cow's milk. Cow's milk is for calves. It's a little too much protein, a little too much fat for us, really. So here are the types of teeth and the roots at the bottom, right? And the other thing I'm just going to mention is dentin makes up the greatest portion of the tooth shell. You heard of dentine gum? Dentin. It's covered by enamel in the crown and by cementum in the neck and root area. Pulp cavity, which is contained in the dentin, has a connective tissue, blood, lymph vessels, and sensory nerves. Now, you know when you have to go get a root canal, they drill a little hole down in the tooth, and they take this little winding machine and they wind up all your nerves, then they pull them up through. Now that tooth is dead because they went down here and got the nerve supply that's in here, wound them all up with this instrument and pulled it through. Those that are going into dental hygiene, they'll learn all this stuff, but that's what a root canal is. It goes down in the root's canal, pulls up all of the nerves. That tooth now is deficient of nerves, has no nerves, and is essentially dead as a shell. Then you have to go through and put an artificial crown on it, etc. So main thing is to really take care of your teeth. They're supposed to be with you for a lifetime. Wayne County Community College has a great dental hygiene program, and you can get on the waiting list to get your teeth cleaned, which they should be every 6 months, so twice a year, and try to get your children on that same regimen so when they grow up they'll still have their teeth until they don't need them anymore. And the same for us. It's not too late to start going and take care of them. The best thing though that you could do to really keep your teeth is not to smoke. Smoking is going to really wreak havoc on your gums, and you need healthy gums in order to have healthy teeth. So, and you're supposed to have your teeth your lifetime. So hold on to that thought and try to, especially during this time of being shut in and we're eating all types of stuff we probably usually don't eat that has a lot of sugar, a lot of carbohydrates in it. So make sure you're brushing and flossing and keeping your dental hygiene up as well. So let's look at types of teeth. You have 20, as I just said, deciduous teeth. These are the baby teeth, right? Baby teeth. And you know that there is, and then they're going to be replaced. The baby teeth are going to be replaced by 32 permanent teeth. And these are adult teeth. Adult teeth. All right. So you start off with 20 deciduous teeth, baby teeth. And then over time, they're going to be replaced by 32 deciduous teeth. How many of you have all 32 of your teeth? Oh, so a few of you do. Some have had to have theirs removed due to dental procedures. A lot of people have to have their wisdom teeth removed because of crowding and how they come in. They may start to erupt in very odd positions, so you have to have those. Very few people have all 32 of their teeth, but that's good if you do. Hold on to them. The first tooth, and we're talking about deciduous teeth now, the first tooth begins to appear about age 6 months. And usually they come down, these little two central incisors down at the bottom. Really, you don't get too much cuter than that, than those two little teeth peeking up through the gums at the bottom. And about every month or so, another tooth appears until all 20 have come in. And you're usually about 6 years old. Especially about 4 to 6 years old when all those teeth get in. You shed the deciduous teeth from age 6 until about 13 years old. So you start shedding them. The first teeth that leave, though, are usually the top central incisors. And then, you call you snaggletooth, whatever, but there again, you don't look much cuter than that and when you lose those two central incisors. And then from age 6 to about 13 years old, the teeth will begin to get replaced. And the last teeth will erupt after age 17. So now you're older, you're 18, 19, 20, whatever. These are called wisdom teeth. And apparently they're wisdom teeth because you're older and you have gained more wisdom. All right, so that's it on teeth that I'm going to really hold you responsible for, but I am asking you to look in your text to go over the crown, the neck, and the root, so at least you'll know the location of those anatomical features. Let's go on and talk about the pharynx. And I know that you know that the pharynx means it's the throat, but we will discuss it as the pharynx. The pharynx allows for swallowing. And what word did we use for swallowing? What word did we introduce for swallowing a little while ago? Deglutition. That's correct. So the pharynx is the throat. And this is where swallowing or deglutition moves a bolus of food from the mouth to the stomach. All right, so the pharynx, the throat, this is swallowing, deglutition, and it moves a bolus of food from the mouth, I said throat, but it's a mouth to the stomach, okay? Food goes from the mouth to the oral pharynx after passing a constricted opening known as the fauces. So you notice if you open your mouth, it looks really wide in the anterior portion, but as you go posteriorly, where you see the little uvula and the palatine tonsils there, it's more narrow. That's called a fauces, because if your throat was as, if the back of your throat and back of your mouth was as wide as the front of your mouth, the food would just, wouldn't have any type of regulation in going down your throat. So it gets a little more narrow to help regulate that. So swallowing or deglutition moves a bolus. A bolus is like when we chew, our tongue and our mouths actually make a ball of food. That's a bolus. And then it moves from the mouth to the stomach, right? So the esophagus. Esophagus. This is a collapsible, muscular, mucus lined tube. And it's about, remember that squiggly line means about or approximately 10 inches long. Okay? The esophagus is a collapsible, muscular, mucus-lined tube approximately 10 inches long. It extends from the pharynx to the stomach. So this tube extends from the throat to the stomach. Now you know the stomach is in the abdomen, because the only thing you have in the thorax are your lungs and your heart and some glands. But the point I'm making is that the esophagus has to go through the diaphragm in order to reach the stomach, okay? It goes through the diaphragm, and as it descends from the thoracic cavity to the abdominal cavity, period. The esophagus is posterior to the trachea, so the trachea sits anterior. That's good, so if you ever need a breathing passageway, it's easy to get to it because the trachea is anterior. And just behind the trachea, posteriorly, is the esophagus. The esophagus serves as a passageway for food, and it's muscles in the esophagus that pushes the food towards the stomach. It's the first segment of the digestive tract where we have all 4 layers of the GI tract. Remember those 4 layers of tissue we talked about a little while ago? The mucosa, submucosa, muscularis, and serosa. This is the first time you see all 4 layers being utilized, and that is in the esophagus. Let's talk a little bit about the esophagus so that you can get an understanding of it. I guess we'll put it here. The esophagus up here has stratified squamous. Stratified squamous. Remember we talked about the different epithelium that we were going to see stratified squamous to prevent ripping or tearing. And we also talked about that we would see columnar epithelium for absorption and secretion. So here's the first time here's where we see some stratified squamous here, right up here in this general area. I'll let you know that this is called the upper, let me put it up here, sorry. This is the upper esophageal sphincter, also known as the UES, I guess you could say. This is the upper esophageal sphincter. The sphincter is usually a round, kind of circular muscle. And along this esophagus, in this upper portion, is stratified squamous epithelium. What does this upper esophageal sphincter do? What's the importance of it? Well, this type of sphincter prevents air from entering the esophagus during respiration. So, in other words, while you're breathing, it prevents air from coming down into the esophagus. So that sphincter will close off occasionally while we're breathing. The next part of this is let me make it kind of round so you can remember that this is a sphincter. This is the lower esophageal sphincter. And we call it the LES, right? This one is the bajillion-dollar sphincter. In other words, Americans take so much medication to control this thing so that they don't get heartburn. So that the food does not go up this lower esophageal sphincter into the esophagus and cause something that we call heartburn or reflux, right? GERD, gastroesophageal reflux disease. Okay, so many medications, the little purple pill, the Pepsid AC, it's a ton of medications to prevent that. So the lower esophageal sphincter is the LES. This sphincter here is to prevent the backflow of stomach acids so that you don't get heartburn. So you have an upper esophageal sphincter that prevents air from getting into the esophagus, and you have the lower esophageal sphincter that is there to prevent stomach acid from going back up into this esophagus. Now let me just show you the divisions of the esophagus is in thirds or in threes. This, let me just try to get it into thirds here. All right, we'll do it like that. So this upper 1/3 this upper 1/3 here of the esophagus, this upper 1/3 of the esophagus is a voluntary striated muscle. So this is voluntary muscle, which we know is striated muscle. So it's like a skeletal muscle, in other words, it's voluntary. And so up here, if you're taking something, and somebody says, "Oh no, don't drink that," you could throw it up if it's like in this general area, right? Because you could voluntarily upchuck it. Here in the middle, 1/3. This middle 1/3 of the esophagus here, the middle 1/3 of the esophagus, this is going to be a mixed area of striated and smooth. So this is mixed here. You have striated muscle here and smooth muscle. So what do you remember about smooth muscle? Correct. Smooth muscle is involuntary. So you, no matter what you're thinking, it's not going to control that smooth muscle. It's going to do what it's going to do. It's involuntary. But the striated muscle, the skeletal muscle, is voluntary. So your thinking can control that striated muscle. Here, if you still have an opportunity to, if you just swallow some poison, you still have an opportunity along up until about this is about 2/3 way of the esophagus to throw it up, whatever that poison or irritant might be. Down here though, to the lower 1/3, here we are in the lower 1/3 of the esophagus here. Lower 1/3 here. This is involuntary. Involuntary muscle. This is all smooth muscle here. This is all smooth muscle here. Pretty much what you have just swallowed, and if it gets down in this general area, it's going to be pretty much committed to go on to the stomach. So it's a little more difficult to throw it up from here, whatever it is, right? Along 2/3 of the way, though, you have a big chance, a greater chance of having emesis from here, but down here, vomiting is going to be a little more challenging. Of course, you can get it. You can get the contents out. I just want you to know that this esophagus, I didn't quite show this, but I want you to know that right at the end of where this lower esophageal sphincter is, the stomach is connected here. All right? This is where the stomach is. So that just gives you an idea of the lower esophageal sphincter and how the acids from the stomach can go back up into the esophagus. Now, I want you to know that this word, GERD, actually it's an acronym for gastroesophageal reflux disease, right? Gastroesophageal reflux disease, GERD. This is the backward flow of stomach acid. It goes up through the lower esophageal sphincter and into the lower, sometimes it can go up higher, but I'll say just lower esophagus. So you can have GERD or gastroesophageal reflux disease. This is, of course, the backward flow of stomach acids. The stomach acid coming down here, hanging out, getting all churned up with the food. It's going back up through this lower esophageal sphincter that is sometimes weakened and goes back up and causes irritation in the esophagus. If this keeps happening, the problem with this is, for one thing, it's uncomfortable. The second thing is it can, it may produce Barrett's esophagus, which is a cancer in the esophagus. This acid can keep irritating the linings here. And the lining of the esophagus will change, and it can produce a cancer there in the esophagus. So that's another aspect of trying to control this acid from regurgitating or going back up into the esophagus. Other ways to minimize that would be number one, and we need a drum roll for this because I need you to understand that smoking is one of the number one causes of GERD. So if you stop smoking, more than likely that will stop the GERD, the reflux, right? Also, have your meals smaller and maybe more frequent, but don't try to eat up to the point of where this stomach can hold. The stomach can hold about 1 to 1.5 liters of content. And people try to eat until they're full. I'm just talking about Americans. And then oftentimes we like to go lie down, or sometimes people even eat kind of in a reclined position. That is one thing that could cause a GERD. If you want to eat and then take a walk, or just keep yourself in an upright position, that will help with reducing GERD significantly. But the number one cause would be for people that are smokers, would be for you to stop smoking, right? I would talk about a hiatal hernia, but that's just really the contents. A lot of people who end up having that gastric bypass surgery end up with the stomach kind of bulging up into the thoracic cavity, and that's a hiatal hernia or hernia. So those are things you have to look out for. The bulging of like the lower esophagus, and even the stomach sometimes can go up towards the chest. And there's not much room up in the chest anyway. You got your lungs there and your heart, so you don't want anything below. Oh, let me show you that this is the diaphragm, for example, that the esophagus does cut through the diaphragm to get down to the stomach. So that is the main things that we have to say for now about the esophagus. We're going to move on to the stomach, and we'll see you next time. We'll pick it up from the stomach and take it all the way to the anus, and that will be it for the that will be it for the anatomy portion of the lecture. All right, until then.